Okay, so somebody participated. Who is the one that says you cannot drink alcohol while breastfeeding?
I said that.
Okay, very good. And that is true. But in the real world, people are going to drink and breastfeed, and there will be professionals and lactation consultants that will give a blessing to do that. And that is because they feel that if they had to choose between not breastfeeding or breastfeeding and drinking alcohol, they would pick breastfeeding and drinking alcohol. But in an ideal world where if, you know, it was between drinking alcohol and breastfeeding or not drinking alcohol and breastfeeding, one would say like, don't drink alcohol and breastfeed. But no, we live in reality and people are going to do what they want. And honestly, sometimes moms just got to live their life. So when it comes to the concepts that people talk about with the breastfeeding and alcohol, you will hear the term pump and dump, which means that would operate under the assumption that the currently existing breast milk, which is stored in your breast, has alcohol in it, and it will remain there with alcohol in it for the duration of its existence. So therefore you pump it out and dump it down the sink. Now, that much research has said is not actually the case. If you have alcohol, if you have milk in your breast that has alcohol in it and your body metabolizes the alcohol in your own body, it is also metabolizing the alcohol in the breast milk as well, so that you in fact do not technically have to pump and dump. I'm sure that there are conflicting views on this, but the evidence mostly shows that if you are currently in a state of mind where you're sober, the milk will be also sober milk. Does that, I'm not sure if I'm explaining it to you guys so that you understand. Like if you're drunk, then the milk that is in your breast at that time is probably filled with alcohol. If you went and took a nap for 3 hours and then you're feeling better and you're all right, then the milk in your breast doesn't still have that alcohol in it, right? So this isn't like I'm saying like, yes, go get wasted and breastfeed or something. No, like obviously the best thing would be have milk be as clean and free of any potential toxins as possible. But when you're working with people in real life, it's just, you know, yeah, and you don't want them to have anxiety and freak out and think that they're doing a horrible thing because the concentration of alcohol in the breast milk is actually lower. It's not like you take a sip of wine, the baby's taking a sip of wine, right? Like it's not one-to-one equivalent like that. And then let's see, the other thing that I wanted to point out was the actual detriment in this case would be that I keep hearing feedback of me or some kind of noise. The detriment in this case would be if mom is carrying a baby and she's drunk. Like I think that the more immediate concern would be that she would drop the baby or harm the baby or not take care of the baby or fall asleep while holding the baby. I think that would be a more immediate concern than baby's going to get a little tipsy from drinking breast milk that has alcohol in it. So, I mean, you got to decide where your concerns lie. Another concern I would have is like, does this mom have an alcohol problem, or she's just like casual, like 1 glass alcohol curious about its transmission to the breast milk, or is it like she literally can't go a day without drinking? You know, you want to explore these. It's not just this cut and dry, like black and white, do or don't do. It like it's really dynamic. You got to ask a lot of questions about this sort of thing, and you just have to pay attention to the baby's reaction to the milk. When one is breastfeeding and they're pumping and they're going to freeze their milk for later, they typically do mark the frozen breast milk as being pumped in the morning or at night, because there's different breast milk in the morning is different than breast milk at the night and during the night, right? So you want to make sure you watch how does the baby react. So if you do have breast milk that has alcohol in it, the baby might not act like its normal self and get very sedated to that sort of thing. So you want to pay attention. Additionally, they do make testing strips. You put a sample of the breast milk on it and it will actually tell you if there's alcohol in it or not. So to say that you shouldn't drink and breastfeed, yeah, I mean, if you're going to make a rule, that's a good one. But a lot of times when you're dealing with patients or humans in general, they're not going to stick to things that are difficult to stick to, right? They might, you have to work with them a little bit. And you also don't want them to be worried and up all night, like, oh, I did this horrible thing. So a lot of lactation consultants will actually say, all right, it's okay to drink a little bit. I mean, I've definitely been places where people are drinking and breastfeeding. But the more immediate concern is like, you want somebody sober and okay to be able to take care of the baby. But don't come out of this and say, Dr. Waggel said it's okay to drink and breastfeed. I didn't say that, but I am saying that some professionals do say that. So that was the first comment. Was there any other comments unrelated to alcohol, but related to breastfeeding?
I don't know too much about breastfeeding, but I've heard that when women breastfeed, they have a lower chance of certain diseases.
No. Let's see. I can't say I've heard that, but I have heard that when women are breastfeeding, they have a lower chance of getting pregnant. But not zero, because I've seen a lot of breastfeeding women get pregnant. The whole disease thing, I don't know. You're going to have to look that one up and show it to me, because I'm not familiar with that. But I applaud your participation. Anybody else?
Yeah, I had a question about breast milk versus formula milk. Is there a specific reason other than like a personal preference why a mom would prefer to use formula milk over breastfeeding?
Oh man, so this is a good question. There, even amongst physician mothers, and I'm not talking just mothers in general, I'm talking about women who have babies that went to med school, even among them, there is a debate. I think most would say you should try to breastfeed, but there, kind of like with the alcohol thing, it's not that easy. It's especially when taking into consideration mom's mental health and the millions of things that she has to do, and how utterly difficult breastfeeding can be for some, if not most, women. They have been able to replicate much of the nutrients that are in breast milk. And in fact, formula has vitamin D in it that breast milk does not. So if you're exclusively breastfeeding, you are supposed to supplement with vitamin D drops. So there's one thing that formula would have over breastfeeding. But the American Academy of Pediatrics and Marcus sent us a link. Like, that was quick. I mean, I haven't heard of all research. We'll look that up in a second. So, so whenever, oh man, I'm getting like tired. It's the end of the day. The actual breast milk is going to have antibodies in it from the mom, which isn't going to be in the formula. So the American Academy of Pediatrics, and pretty much all professional medical societies would endorse breastfeeding, but probably not at the expense of the mental health of mom. Well, maybe some still would, I don't know. Like, you don't want to take this tactic like breastfeeding at all costs, like even if, you know, mom is completely dysfunctional and in agonizing pain and can't do anything else. Even if you don't care about mom at all, which I unfortunately feel like some schools of thought don't care about mom at all, you do have to care about mom in order to care about baby. So if the breastfeeding is just so taxing that it negatively affects mom, and say they don't even care about mom, which they should, because like she's a human too. If mom can't take care of the baby, then bad stuff happens to the baby, right? So I think formula is great for moms that are struggling. And like also, like, what if you just literally cannot produce milk? Try as you might, it may be physically impossible. So what do you do in that case? You just don't feed your baby? Like, so there's very, I'm actually, I don't even know if I'm kind of afraid to post this online, because there's very strong schools of thought. Breast is best, and then it's like fed is best, meaning like, I think the best thing you could do is like make sure your baby's fed, right? So what if you're only producing a tiny bit of milk, but you feel stigmatized against using formula because people will shame you and say, oh, you shouldn't use formula, you should use breast milk. And then your baby is having something called failure to thrive, which is because you're not producing enough milk to actually feed your baby, but you're not supplementing with formula because people are shaming you about formula. I honestly didn't realize like how big of this like cultural like mom guilt and like shaming stuff comes along with having a baby, but the whole like breastfeeding or not breastfeeding thing is like a really heated debate. And a lot of people, just because breastfeeding came maybe easy to them and they feel like it's the best thing, they kind of put that onto other people, but other people were like, hey, like I literally can't produce milk, or it's excruciatingly painful, or like I'm working 2 jobs and how am I supposed to breastfeed and work 2 jobs? And what if I quit one job, then I'll lose my house and my baby and I will be out on the street. I think you really have to consider each on a case by case basis and not just be like overall, like everybody should breastfeed, or overall, like everybody should formula feed. Although most organizations do say overall, like you should breastfeed. And then there was a big, I think as people like to get worked up about stuff, the recommendation came out that you can breastfeed until 2 years, but I think I actually didn't read it. I heard many different interpretations of it, but then I heard that I didn't know what the exact wording is, but the idea behind it was to say you can breastfeed until the kid's 2, but a lot of people read it as you need to breastfeed until the kid's 2, which if they did come out, and now I have read recommendations of 6 months and some say a year. And that's like, whatever, fine with me, but I actually would get like really worked up if it was like you need to breastfeed until the kid is 2, because I'm like, whoever wrote this, have you ever like been a mom? Like that's really putting a lot on us, because it is a 40-hour-a-week job. And it's not like, oh, you can just like pump or breastfeed while doing other things. Believe me, I've tried to like type or like get stuff done. It's not like a passive thing you can just do in the background while reading or like working, right? So by telling a mom that you have to have this additional 40-hour-a-week full-time job for 2 whole years, of course people got upset. People got very upset, and they're like, what are you asking of me? You know, everybody always wants so much from me anyway, and now you're saying I have to breastfeed for 2 years. But the idea behind it was not to make the moms that are having a hard time or unable to breastfeed feel bad about not breastfeeding for 2 years. It was to make the moms that do breastfeed older children feel more comfortable about it, and say that, oh, you can breastfeed. I mean, technically you could breastfeed for the rest of the kid's life. Would society have a lot to say about that? Yeah. I mean, at some point, you might want to call like CPS to investigate, like if you're breastfeeding a 15-year-old, like, but I actually do personally know people who breastfeed their 6-year-olds, right? And of course, a lot of people would say, well, that's kind of weird and strange. But the moms who were breastfeeding older children, they were feeling bad and feeling shamed. And so you don't want anybody on either spectrum to feel bad, because it's not a situation where it would be very straightforward, like, don't smoke crack while you're pregnant. Like, that is a situation where, yeah, it's not up for debate, and it's not this black and white territory, and it's not something, well, some moms can smoke crack. And so, like, that is an example of very cut and dry. Yeah, just don't smoke crack while you're pregnant. Just don't do it, right? But when it comes to things like alcohol and breastfeeding, or breastfeeding versus formula feeding, you can say, okay, different things for different people. The end of the spectrum, we don't want them to feel bad for breastfeeding their 6-year-olds, because people will say that's weird. Like, you don't want them to feel bad, but then you also don't want the other end that can't produce milk. Like, so to take it with the approach of like trying to apply the very cut and dry, black and white, don't smoke crack while you're pregnant, which is, yes, don't smoke crack when you're pregnant, and taking that kind of approach and putting on something that should be more flexible, it shouldn't be that way for certain things. Like, if a mom wants to breastfeed her 6-year-old, let's not shame her. And if a mom doesn't even want to breastfeed, maybe she can produce milk and she doesn't want to, like, don't shame her either, sort of thing. But it's at least good to have some kind of guidelines, because people do look for a professional resource to give them some idea, right? Like, but when you are giving those guidelines, you want to be clear, and you want to make sure that you explain this can be applicable differently in different situations. Unlike smoking crack, no, that's really not different in different situations. I don't really care what your situation is. Please don't smoke crack. So hopefully that makes sense to everybody. So, pop quiz, what was the vitamin that I said is actually lacking in breast milk that you do have to give to the baby as a supplement, that if you were formula feeding, you would not have to give?
Vitamin D.
Yes, you guys are paying attention. Yes. Okay, very good. All right. Any other fun facts about breastfeeding?
So I've heard that.
Oh, wait. Oh, actually, so Dashita, did I say your name right?
Yeah.
You will go next. But Marcus, what was the thing you sent? Because I'm afraid to touch my screen. I saw something pop up. Was there some kind of thing that we're protected against when we're breastfeeding? That
Yeah, I wasn't sure if I was right about it too, so I just did a quick Google search, and I found the CDC said that it prevents a little bit against 2 types of cancer, type 2 diabetes, and high blood pressure for the mother.
So breastfeeding, protecting against, well, I can see the type 2 diabetes, because breastfeeding actually burns about an extra 500 calories a day. But what were the other ones?
Breast and ovarian cancer and type 2 diabetes.
Yeah, I mean, it looks like it does say that. Well, you know what? I can't comment too much about that one way or the other, because obviously I didn't know about it until 5 minutes ago, but that would be something good to look up. Yeah, we'll have to look that up and get back, because I can't obviously comment on that. But I understand how the diabetes protection would work, and the blood pressure one, but reducing cancer is, oh yeah, I guess you're right. Good job. We all learn something new every day. All right. And so please remind me of how to pronounce your name.
Dishita.
Dishita. Yes, it was your turn. What were you going to say?
So I've heard that breastfeeding provides certain like immune system benefits for the baby, like passing on antibodies or like certain benefits that the mom has gained from having like taken some vaccines or like the natural defenses she's produced from like certain diseases she's had in the past or different illnesses. So could you like explain a little bit about that?
Yeah, so well, that was one of the benefits why they do recommend the breastfeeding. So there's a lot of positives to the breastfeeding, like skin to skin, which they also call kangaroo care. That's a good one. And the passing on of antibodies, which obviously you can't pass on your antibodies through formula, right? So they did, let's see. I guess we would have to start with is like, do you guys know what antibodies are in the first place? Does somebody want to tell me?
Antibodies are basically like your body's way of detecting a certain foreign. Antibodies are the foreign invasive thing to your bodies, and they bind to antigens in your body to tell your body that something's in it that shouldn't be.
Right. Okay. Yes. So, and when you get a disease, your immune system looks at it and then it creates antibodies, and the next time it already has. This is like such a rudimentary, rough explanation, but the next time you're exposed to it, you most likely do have some lingering around so that you don't have to wait around and make them again. Anyway, you're storing them. And let's say that I have antibodies to the lizard flu, right? Like I got exposed to the lizard flu when I was 5 years old and I created antibodies. And then I breastfeed my kids. They, through the breast milk, will convey the lizard flu antibodies. And so when my kids are exposed to the lizard flu in the future, they will have some protection against it through my breast milk, through the antibodies that I made. Does that make sense to everybody?
Yeah.
Okay, okay. Very good. All right, what else does anybody know about? Does anybody know about any hormones in breastfeeding?
I just had a follow-up question on Dashita's question.
Yeah.
So what extra precautions would a family who was choosing to use formula milk take in, like, since there's a lack of antibodies with that?
So are you asking with if a family decides to not breastfeed and they're going to do formula, what precautions they need to take given the fact that there's not going to be antibodies in the formula?
Yeah, so if like their kid was more susceptible to certain diseases because they didn't get the antibodies from their mom's breast milk, what precautions would they specifically like need to take compared to someone who is breastfeeding?
So I'm not an immunologist, but from a practical having lived standpoint, I would say sheerly from observation that the kids who have breastfed and the kids who have formula fed get sick about the same frequency. If I was an immunologist and I had like all these studies up with research, I would surmise that out of billions of human beings having lived, that there is less of an incidence of disease in babies who are breastfed but it hasn't translated to a point where it's like noticeable to the naked eye, if you will. I know lots of babies. I know lots of moms. I know a lot of little kids that were formula fed. I know a lot of little kids that were breastfed and heck are still breastfed to this day. And it just seems like little kids are always sick all the time. And I have not noticed any difference in the frequency versus the kids with the breast milk and the not. Now, again, I would venture to guess that if you looked at it globally with statistics and, you know, you used your SPSS software and you analyzed it, there would probably be a significant difference where, yeah, the baby with the breast milk was more protected, right? But it's not to the point where it's noticeable, and I've not seen anybody take any quote unquote precautions. It's just, and you want your kids to kind of get sick in that if they don't, then they won't develop the antibodies. So during COVID, my kids like never left the house or like interacted with any other kids, which considering my kids were born during COVID, that's the entire duration of their life. And they were barely ever sick. And if I continued having them live that way, they would pretty much maybe like if they just lived in my house until they were, 100 years old and died, they probably wouldn't get sick that much. But the second that they would leave, they would just get everything and they would get it bad. So I knew that when they go into daycare, they're going to get sick all the time because kids in daycare just get sick all the time. They're picking each other's noses and they're licking the floors here. I mean, they're just sick all the time. And I knew that that was going to be the case. But I also knew that if they don't get these diseases now, they're going to get them if they leave the house. And you want to protect your kids in that you don't want them to get sick, but you also want to protect your kids in that you want them to get sick enough that they develop the antibodies. So I know that if you give them breast milk, they'll have antibodies to certain things, but the way that the diseases work is that they mutate. And like the lizard flu antibody that I bestowed upon my son, well, what if he never even was exposed to the lizard flu because it died out? Because we all know I'm almost 40 years old and it's an ancient disease or whatever. And now instead of lizard flu, it's chameleon flu that's going around, and he was sick with that. So I might be protecting him with antibodies to something that he's never going to get exposed to anyway. So it might not be very useful in that regard. So one interesting thing about antibodies and like generational differences is that when I was 4 or 5 years old, the pediatrician actually gave me the choice to get the vaccine against the chickenpox or get chickenpox. And being a little kid, I did not want a needle stuck in me. I didn't want the vaccine. So I said, I will get chickenpox. And there used to be these things called chickenpox parties where you just go and you take your kid that didn't have chickenpox and make them hang out with a kid that did, so that your kid would get chickenpox to get the antibodies and get on and get over it and move on with life. Because if you get chickenpox as an adult, it's bad news. If you get it as a kid, it's not that big of a deal. I mean, it was a big deal because like I do actually still have scars from having chickenpox. But every single kid in my class got chickenpox, and that's how we got our immunity against it, not via vaccine. Now it is my understanding that they don't give kids those choices. They just vaccinate them. So things have changed, but you got to get antibodies one way or another. You get them through a vaccine, you get them through breast milk, you get them through going to daycare and licking some other kid's nose. So to answer the question about like the precautions that you would take if you're not going to breastfeed, I mean, I personally don't know because I did breastfeed both of my children. So I don't know if I don't know what precautions I would have taken. You would have to ask somebody who did formula. And well, I guess I did do formula after I was done breastfeeding. Because do you know what age you can give a child whole milk? Like not formula, like straight up, you go to the supermarket, you buy milk out of the refrigerated section. Does anybody know?
I think it's like after a year, but
I
I'm
think
not
it's
too
like
sure.
1 to 2 years.
Yeah, it's a year. So when the kid turns 1, you can give them whole milk. You don't give them skim milk. You don't give them almond milk. And again, you know what? Like, these are the recommendations. I'm sure that there's some families out there that are like, we like our vegan milk or whatever. You know, that's something you need to talk to your own doctor about. But at age 1, you can give whole milk, which is good because formula is so expensive. And I'm glad I was able to breastfeed, because while I was breastfeeding, there was the whole formula shortage, which we live in the United States of America and people couldn't get formula to feed their babies, which was absolutely, I guess, a political issue that I'm not going to get into now. But you need to either be breastfeeding your child or using formula until your kid is 1. Now, you can supplement with baby food at what age? And this is a tricky question because the powers that be can't even agree on this age. But give me a rough estimate of how many months you think the baby needs to be before you give, you know, like the classic baby food, like the orange mushy carrots or the peas.
Maybe like 6 months, I'm guessing.
Yeah, I was gonna say
That's a good guess. 6 months. I actually started both my kids on solid foods at 4 months. So 6 months, some of them say 4. Again, it's like depends on the kid. Like my kids, I could tell they were like reaching for my spoon. They were like chewing on things. If your kid's not into that, I mean, you're gonna know. Like you're gonna take a little spoonful of those nasty mushy carrots, and it's just not gonna go well. But like my kids are like trying to eat everything, and they loved solid foods like that. So I did 4 months. So yeah, you will either breastfeed or formula feed for the first year, and then you can do just whole milk. But they also make like toddler formula, which I kind of want to say, like, I feel like people are just trying to make money off of that. But maybe there is some reason you would do that. I mean, whole milk is fine at age 1. And then you can start adding some like baby foods and things like that at 4 to 6 months, but it depends on your kid. Maybe they're like, no. All right, let's see. But nobody knows anything about any of the hormones.
I believe it's like prolactin, and also I wanted to apologize because I'm at work, because like I have like the time conflict, and also I realized that like my mic was not on mute, so I do apologize for that. But to answer your question,
It's actually fine, because if you're at work and you're not like, I don't know, at a rodeo or something, you're at the circus or no, it's fine. So prolactin, which actually that's pretty good because it has the word lact, which is like lactation, so that is an easy one to remember. Yes, prolactin, that is it. Does anybody know any other ones?
Oxytocin.
Oh my goodness, exactly. So oxytocin helps like the smooth muscles and like the glands. It also works on the uterus, like when you're in labor. like muscle contractions, and then for like the prolactin that helps with when you're nursing. It's so they do other things too. Like, has anybody ever heard that like oxytocin is like the like love hormone kind of? It's like this like hormone that I feel this is not science, but it's just like this hormone that's like exists in your aura. It's like, as a mom, like just being around a child, you get this like feeling, oh man, this is not medicine, this is like me being a hippie or something. But that to me is like what the oxytocin is, because you have heard like when breastfeeding moms hear a baby cry, they start lactating, right? Like it's just something out there floating around that just makes it happen. So oxytocin is the milk ejection. It just, I guess it squirts out when you feel the sensation of a baby in the room with you. And then prolactin is the milk production. And so you got to have like a nice regulation of the two. And of course, like sometimes there's dysregulation, and this is fun. Well, maybe not a fun fact, weird fact. So obviously, like, I'm really like outgoing and then maybe slightly weird. And so in medical school, I was the same way. But I asked the questions that everybody's thinking, but they're too afraid to ask. So in a room of 181 of us, when we were talking about breastfeeding, I asked, can men breastfeed? Because everybody wanted to know, but everybody was afraid to ask. And the answer, my friends, is yes. In general, no. Very rare. It's the suckling. It's the sensory from the nipples. It comes back, makes the prolactin in the blood. You would have to. Okay, I would actually say no, men can't breastfeed. But if you really, really wanted to, and you had suckling at extensive stimulation, I honestly don't even know how many days it would take or how many hours each day of suckling. But the answer to my question was, yeah, it is possible. So that's a fun fact, everybody. Everybody's minds are blown right now. Well, actually, does anybody know what a wet nurse is? Nobody knows? Because if you think of the concept of a wet nurse and
know what it is.
extrapolate that. What is it?
I know what it is, but I don't know if I can like say it without like, okay. It's like a woman employed to like suckle another woman's child.
Right. That's actually, yeah, what it is. So
okay.
before formula, what would happen if the mom couldn't breastfeed? They would just let the baby die? Well, maybe in some cases that's what had to happen, but if formula didn't exist, somebody else is going to have to breastfeed this baby. And so if you take that, if you have a baby suckling long enough, you can make things happen, and that is the concept of wet nurses. Now, I feel that most professional wet nurses never stopped breastfeeding to begin with. Like most of them probably had their own children and then just breastfed forever without stopping. But that's what they used to do before formula if the mother could not produce milk. Or I think it was quite popular in like the royal people, is just, maybe they're like, I don't have time for this, which is a 40-hour-a-week commitment. And I guess if you're the Queen of England and you're ruling a country, and you have a baby, you're probably going to be like, well, I don't have time to breastfeed this baby. So if the mom couldn't make milk or didn't want to before formula, that's what they had the wet nurses for. I doubt that they employed very many men as a wet nurse, but it could be in the realm of possibility. I'm not saying like I would recommend it or anything. I'm just saying that it's not impossible. So I think that was interesting talk to have for World Breastfeeding Week, don't you guys?
Yep.
Yes, new and
Yeah.
fascinating information. If you guys, your parents are like, what did Dr. Waggel teach you? You're going to say, oh, that men can breastfeed. And then you're going to scare them and they're never going to let you. But hey, I'm just letting you know what my professor in medical school told me. And I guess we'll follow up. Sri or Mary,